let's go through these 10 important aspects to be aware of as they relate to bipolar disorder. So let's get into it. Now, bipolar disorder used to be called manic depression. And that's because it's called bipolar because you have two poles of mood. You have high, which is hypomanic or manic, and then you have the opposite pole, which is depression, major depressive episodes. And so that manic depressive, it included both of those poles, but instead they changed the name to bipolar. So, but there's a lot of confusion about it. And this is a medical condition, obviously. It is often misunderstood. It is massively misdiagnosed all around the world. And we're going to try to simplify that and help you to understand a little more about it. Now, if you think that you may have bipolar disorder, it's important to go to a qualified mental health professional who can help you identify that. And it's not just sitting down and saying, yeah, I get real angry sometimes. Things happen and I just fly off the handle. That is not bipolar disorder. That is typically, it is a conduct disorder and an impulse control disorder. So it's important to be aware of that. And there's even distinction between those two. So if you guys want me to get into that, please let me know in the comments and I can make a video on that as well. But here we go. Let's get into it. So, fascinating fact number 1. Now, like all disorders, bipolar disorder is on a spectrum of severity, and it can range from absent, mild, moderate, severe, or even extreme in some cases. Now, each of the different criteria or symptoms are also on that range. So we don't always want to lump everything together and say, well, that's bipolar, it's mild, moderate, severe, extreme. You can do that. But it's always important. So when I'm working with somebody and we're identifying particular symptoms that are problematic, I like to look at those symptoms and get an idea as to the severity, because if we're trying to treat it as a whole, sometimes that can be complicated. Whereas if we can zero in on those specific symptoms that are causing the individual the greatest amount of issues, impairment, problems in relationships, problems with themselves, so on and so forth, that helps us target in a much more effective way. So we want to be aware about that spectrum of severity. Now, there's also, this is number 2, by the way, this is also mixed episodes. Now, individuals with bipolar disorder can have mixed episodes because not all bipolar episodes fit into this neat, distinct box of manic, hypomanic, or depressive phases or episodes. So some individuals do experience what are called mixed episodes. And that is kind of a mix of mania and depression, and they occur almost together. And this can be really, really complicated, and it absolutely adds to the complexity of bipolar disorder. And that's why it's so important to go to that qualified professional who knows what bipolar disorder looks like, who knows what they're focusing on, what they're trying to identify. Because even when these two occur together, if we can get down to a specific level and we're able to better identify what's going on with that individual, we can tease out even those manic phases and hypomanic phases, but those mixed episodes, we get a better idea as to when they're occurring and those phases and how long they're lasting and so on and so forth. That's so, so critical, particularly for management of the disorder. Really, really important. All right, let's go to number 3. Now, number 3 is rapid cycling. Now, individuals with bipolar disorder, they can experience these rapid cyclings, and they go through 4 or more episodes in a year. And that is a lot because you're having those manic, hypomanic phases or episodes. Then you also have the depressive episodes. Now, rapid cycling can make the condition absolutely more challenging. Don't be dissuaded by all of these tests that you can take online and stuff like that. If it's not reviewed or evaluated by a qualified mental health professional, what are you really doing? We don't know. There used to be these quizzes in magazines that would say, oh, find your best spouse, or, best sex techniques that you'll enjoy. Fill out this quiz and stuff like that. Basically, it's doing the same thing now. It's not in the magazines. It's on the internet. So we want to go to a qualified professional. Rapid cycling, we'll see that. But remember, I didn't say it's like in a week. What I said, it's within a year. So it's 4 or more episodes within a year. And it's typically, we see more manic episodes. Now, manic or hypomanic episodes tend to last for a shorter period of time than the depressive episodes. Depressive episodes usually 2 weeks or more, and those manic episodes tend to be 4 days or more. Now, the or more, most people aren't going to make it, and I'll explain that in a second, aren't going to make it 7 days, 9 days in a manic state. You're just not. You're going to start to hallucinate. You're going to start to break down. Likely you're going to go impatient because these extremes of behavior and response require intervention. So you have to intervene to control it. So that rapid cycling is 4 or more within a year period, not within like a week. If we're talking like somebody's mood kind of fluctuates like within a week, typically there's identified triggers, things that set that person off. That's usually an impulse control disorder, not bipolar disorder. All right, let's go to number 4. Creative connections. Now, there is some research that shows a potential link between bipolar disorder and creativity. Now, not everyone with bipolar disorder is particularly creative, but there is a high prevalence of artists, writers, and musicians who have reported that they've been diagnosed with bipolar disorder. Now, we don't always know, and this isn't the same, we don't always know if they went to a psychologist, psychiatrist, and had that accurate diagnosis, or if they feel that way. But many of these individuals, artists, writers, and musicians report that. So there's just that connection. It tends to be more of a correlation, just sort of a relationship, than it is a causation. Okay, so it's important to note, though, that creativity is not a complex trait that's influenced by various factors. A delay in diagnosis. Now, many individuals with bipolar disorder experience a delay in receiving an accurate diagnosis. This delay is often due to the complexity involved in the symptoms, presentation, getting an idea of those particular phases. Often, individuals are misdiagnosed at least 2 years prior to getting the accurate diagnosis of bipolar disorder. That's so important to realize that and recognize that you have to go through the process. To really minimize that delay in accurate diagnosis, again, it's recognizing those symptoms, recognizing those phases, and those behaviors, particularly the manic and hypomanic phases, they're outside of the usual behavior. Now let's go back and let's contrast that to the impulse control issues. Impulse control is, again, you don't get what you want, you get frustrated, you get angry, and you fly off the handle, right? Or you come home and the dishes aren't done, or you come home and stuff is messy, and you just freak out. That is not bipolar disorder. That is an impulse control disorder because you saw something, set you off, and you responded in an aggressive way. Now, my other videos I talk about using maladaptive beliefs, behaviors, and patterns to manage stressors. And often over time, as those maladaptive beliefs, behaviors, and patterns, as they become sort of internalized, they become this habitual response set that individuals engage in, that can lead to what we call personality disorders. And that's because you have a prolonged response pattern that impacts not only how you see yourself, but also relationships. Now, in order to minimize that delay in diagnosis, again, we want to be able to look at those phases. Not always are we going to see an identifiable trigger. We're not always going to see that, and it's really unlikely in individuals with bipolar disorder because we see those phases. So if there's dishes in the sink and you fly off the handle and you're more irritable and things like that, do you hold that high level of response for 4 days? Not sleeping, maybe engaging in promiscuity, gambling, other types of just high destructive, high energy behaviors? Probably not. It'd be really hard to do that. And not because the dishes weren't done, right? So that helps to sort of frame it a little more. Well, let's keep going. Let's go to number 6. Now, these are genetic factors. Now, bipolar disorder, it does have a strong component of heritability. Now, individuals with a family history of bipolar disorder are at a higher risk of developing the condition. However, not everyone with a family history will develop bipolar disorder. And the interplay of genetics and environment factors is absolutely complex. It can be very different growing up in an erratic household, an unstable household, where that individual comes home, dishes aren't done, flying off the handle and all that other stuff. Remember, we talked about that being an impulse control disorder, and whoever's in your house, particularly if they're little, they learn that that is an appropriate response to the dishes not being done. That is an appropriate response to when you're frustrated, is to act out, scream, yell, whatever it is. And when we talk about genetic factors, what we're looking at is accurate diagnosis of bipolar disorder. Then what we look at is we look at their children, we look at mom, dad, brother, sister, cousin. What is the influence of heritability? And then we can always get a pretty good idea. Now, it does increase the probability of developing bipolar disorder. So we have to understand that, is that if mom has it, dad has it, there is that probability that their child, their biological child, is at risk for it, but it doesn't mean they're absolutely going to develop it. All right, number 7. What is the health impact of bipolar disorder? Well, it has several physical health implications. Now, individuals with bipolar disorder, they have a higher risk for certain medical conditions. And these can be cardiovascular, diabetes, even obesity. And this emphasizes the importance of having a holistic care plan and addressing both mental and physical health. Now, these happen often because of medications to manage bipolar disorder. It can also be because when you're in hypomanic or manic states, you're not really paying attention to what you're eating. You're not exercising. You're not taking care of yourself. And then when you hit those depressive phases, a lot of times people try to manage their depression with sweets, sugars, unhealthy food, and alcohol. Alcohol and drugs, absolutely. Now, here's an additional component that I was going to save to the end, but I'm going to throw it out right now, is that you never diagnose an individual with bipolar disorder or any other mental health condition while they are using or under the influence of alcohol or another substance, cocaine, marijuana, methamphetamines, heroin, whatever it is. Because then you're only diagnosing them while they're using the drug, which isn't their real genetic, sober, clean self. And that's what we want to do, because what happens is that, and this happens a lot, and it shouldn't, but they will get prescribed medication to manage those symptoms while they're under the influence, but then they continue to take the medication while they're not under the influence. Sometimes they're incarcerated, sometimes they go to a rehabilitation, whatever it may be, and they continue to take that medication. Now, bipolar medications can also help to lengthen the fuse for those who have impulse control related disorders. So we can get an additional benefit. But, and if this is getting confusing, just try to stay with me. You may need to rewind it for a second or two just to rehear this. But again, if you're coming home, dishes are in the sink, flying off the handle, and then you start pounding whiskey, bourbon, beer, whatever it is, and you're flying off the handle, are you flying off the handle while you're under the influence? What if you're sober? What about periods of sobriety? Are we still seeing that impulse control behaviors? That's when we would identify the impulse control behaviors. What about bipolar disorder? Are we seeing that you could be going on drug binges, things like that? And that could be during a manic phase. So sometimes, again, you have that confusion that talks about the complexity of bipolar disorder. So what we need to do is we need to get them sober, get them clean. And we have to see then, are we seeing those phases, those manic, hypomanic phases, and those depressive phases? Critical, critical, critical. Number 8, these are seasonal patterns. Now, some individuals with bipolar disorder experience what are called like seasonal patterns in their mood episodes. Now, this is like a phenomenon, they call it, and it could be known as seasonal affective disorder. I'll put a link to that video right here if you want to learn more about that. So changes in light and weather condition can influence mood swings in certain individuals. So we want to tease out bipolar disorder from seasonal affective disorder. And we also want, which is why it's really important to get a good history, because we want to see, are we seeing changes in behavior and mood as they relate to the seasons? Because some people do have a seasonal pattern. Also depends on where you live. So that's critical as well. Number 9, medication challenges. Finding the right medication and dosage is a complex process. And what works for one person, well, that may not work for somebody else, and we know that, and it may take time to identify the most effective treatment plan. Remember, I said earlier, we talked about those 2 years of misdiagnosis, typically 2 years. Sometimes it's much longer. But that you have that period of time where they're not sure. That can sometimes be to medication changes, finding the right medication. Now, that's critical for bipolar disorders, getting that right mixture of medication. Now, I specialize in personality disorders. Now, there's no medication for personality. We've all met people, right, in our personal lives, and we're like, man, I wish there was a medication for that, for somebody who is like jerky or whatever. But there's no medication for personality. Personality is a much deeper construct, much deeper factors. So you can learn more about that at my channel. I want to stay focused on bipolar disorder here. But medication adherence is crucial, critical for managing symptoms. And it can be really challenging for the individual. So that's why if we're looking at bipolar disorder or any type of medication that is prescribed to help manage the condition, who else in their life can help them do that? Now, our phones are great to help us do that, right? That's terrific. But who can follow up? Who can be sure that you're taking it every day? Because what happens is that when you go in the manic phase, you're not going to take it because you have all this energy and you're usually excited and it's fun. And I don't mean fun like party time. I mean like you believe it's fun, like what you're doing is great. Your insight is highly impaired. So you're acting in these behaviors that are so destructive, but you don't see it because you're in the manic phase. And then in the depressive phase, you don't have the energy to take your medication, to get up and take it, and you usually believe it's hopeless, and that's depression. Starts talking, giving you that family in the head, telling you, oh, you know, nothing's going to help, nothing's going to help. That's all that negative speak, and it encourages a lot of those central components of depression, hopelessness, helplessness, and worthlessness, right? And there's other components, fatigue, you know, so on and so forth. I don't want to get into that here. I have other videos on depression. I'll put one here if you want to check that out. So the last one, number 10, lifestyle management alongside medication. Lifestyle factors such as sleep, huge, stress management, huge, and maintaining a regular routine. This can play a significant role in managing bipolar disorder. And disruptions in these different areas, right? And in a decrease in sleep quality, increase in stress. And we know that sleep and stress, they're not buddies, so they don't work well together. And that's really problematic. So we're always, when I'm working with someone who has bipolar disorder, we're always trying to get an idea. How are you sleeping? What is your stress management? How are you dealing with and maintaining that routine? Routine is critical. Interestingly, when they go into those manic, hypomanic phases, they don't want to stay in their routine. They hate it because it's not fun. It's not the party, right? It's not that manic party time, right? And then when you go into the depressive spiral or the depressive episode, so what happens is, well, you don't have the energy, so you don't care. I'm not doing that routine. Heck with it. I'm not going to do it. So it disrupts that routine. It's so important to stay in that routine as much as you can. Now, it's important to note that bipolar disorder can affect each individual differently. And treatment plans that I create for my clients are personalized, specific to their needs and the experiences as well as their interpersonal system, the people in their life that are supportive. Sometimes we got to talk about some unhealthy people in their environment that may encourage alcohol, drugs, partying, staying out all night, promiscuity, gambling, things like that. So we have to be aware of that. So if you know someone who is dealing with bipolar disorder or you suspect that you or someone you know could have bipolar disorder, it's really, really important. Go to a mental health provider who can help you identify it because it is a critical step in managing your life and doing it differently. You absolutely can do it. I hope this was helpful. Leave some comments, like, share, and subscribe, and I'll see you next time. Bye-bye.